Hi guys, it's Michelle from Full Motion Bodyworks, and I am here to take you through some mobility moves for golfing. If golf is your thing, this video is for you. So when it comes to golf, things to focus on are thoracic mobility and rotation, and also hip mobility and rotation, particularly in the hip flexors. So we'll do lots of that. We'll do a little bit of mobility work, and we'll also do some activation working on your anterior and posterior oblique slings, which is the connection between this shoulder, this hip, this shoulder, this hip, exactly what you need to do that swinging movement and get the most out of your swing. So things that you should have handy for this workout, or I guess stretch class. I've got a strap here, a yoga strap. A belt would work fine, or a scarf is great. You can even if you're really ambitious, pull your driver out of your club bag. It would have to be your driver just because you need the length of the club, and depending on your mobility, you might be able to use that. So we've got that. I've got some yoga blocks here just in case I need them. I've also got a bolster that I always kind of have handy, but you really don't need a whole bunch. And a mat or a softer surface, because we're going to be doing a little bit of activation work on our hands and knees. So let's get started. We're going to start by warming up the hips. So go ahead, have a seat, bring your feet out in front of you. Doesn't matter if it's shoulder width, hip width, whatever feels most comfortable for you. And you're going to drop both knees to one side and then the other side. So you're just going back and forth here. Nice and easy to warm up the hips, thin out some of that synovial fluid, get yourself ready to do a little bit of stretching in that joint. So just side to side, take note if one side feels better than the other, one side moves better than the other. Good, come right back up to the top. So now we're gonna drop both knees to one side, and you're gonna kind of shimmy your feet so that you're kind of in a 90-90 position with your legs. So front leg is out at 90 degrees, back leg is bent about 90 degrees. It doesn't have to be an exact science, but you're gonna make yourself nice and tall, lean your chest over that front knee. Take a nice deep breath here. And then you're gonna come up and you're just going to lean back, away here, kind of push this knee down into the floor to kind of open up the front part of the hip here. And then we're gonna repeat that. So we're gonna go forward here. Nice deep breath. Then come back up and lean back here. Good, then from here, you're just gonna come up and over to the other side, same thing, 90 degrees-ish, 90 degrees. Make your chest nice and big. I'm just gonna move here so you guys can get a different view, and you're going to go over that front knee, shin area. Take a nice deep breath there. And then you're gonna lean back, open up the front of the hip, kind of push this back knee down into the floor to really open up through here. We're gonna do that one more time. Over that front knee. Nice deep breath there. And then come on back, lean back, open up the front of the hip, push that back knee into the ground. Good, and come on up. You can bring your legs crossed if that feels good for you. You can always take a folded up towel underneath you to kind of help if you're a little bit restricted. So have your belt or scarf nearby. We're gonna warm up the shoulders a little bit before we kind of dig into those. So take your fingertips on top of the shoulder, and you're gonna rotate your elbow forward to start with. You'll have to excuse me, I have a sick toddler and a 5-month-old who woke up in the middle of the night to eat, so not a lot of sleep over here, and my voice is raspy. And then we're gonna switch directions, go back. So circle back behind you. So warming up the shoulder joint here before we dig in. So when it comes to golfing, of course, thoracic mobility is important because you've got that rotational piece, but also the connection between the shoulders and the hips is very important as well. We're gonna switch sides. So take fingertips here, roll that elbow forward to start with. So keeping a healthy relationship between opposite shoulder and opposite hip will really help you power your swing up even more. And you'll have to, you'll work less, but you'll get more out of it. And switch directions. The more restricted you are, the more you have to compensate to swing your club, and the more mobility you have, the less power you have to use to swing. And the power will come from the right places, which is important. Good, so we're gonna start getting into the shoulders by taking your hands, bring them out in front of you. Take one elbow and place it over the other elbow, kind of inside. So inside the elbow, bring the other hand up. If you have the mobility, you're just gonna wrap your hands around, kind of in like a little prayer hands here. If you don't, here is fine, just go with what you can. And then I want you to imagine pushing your elbows out away from you. So I'm gonna turn so you guys can actually see what I'm doing here. So you're gonna push your elbows out away from your body, and then nice and slow, you're gonna bring your hands up towards the ceiling and down towards the floor. So this is really opening up those shoulder blades, getting kind of in between, deep in the back tissue there. Up and down, up and down. We'll do a couple more. Take some nice deep breaths here, trying to open up those shoulder blades, get your scapulas winging out. We'll do one more up, down here. Good, and then you're just gonna switch. So other elbow goes in the bottom elbow. Prayer hands here, push them out, and then go up, and then down. Nice and easy, up and down. Do two more here. Make sure you're taking nice deep breaths. You might find that one side was way easier than the other. It's totally normal. Good, go ahead and uncross, bring your hands behind you, just kind of open up the chest here. Good, go ahead and grab your belt, scarf, driver, whatever you have handy. And we're gonna work on complete rotation of the shoulder joint using this strap. So when you're going through a full range of motion in your shoulders, you want to make sure that your shoulders feel stable, especially if you have dislocated your shoulder at any time, doesn't matter how long ago. You want that stability to help your shoulder joint feel safe to go through that full range of motion. So that's where this comes in handy. You're going to take whatever you've got, your belt, strap, club, and you're gonna pull on it tight. And I want you to keep pulling the whole time. You don't want it to go slack at all. Okay, so pull tight here, and you're just going to, nice and slow, drop that strap back behind you as far as you feel comfortable. So if you get to here and you're like, oh, that's it, I feel like my chest is gonna rip open, start coming back up. I'm just gonna go all the way down here. And this is not a race. The slower you go, the more mobility you will get out of your shoulder joint. And we're just gonna repeat that a few more times. So the goal would be to move your hands in closer to each other each time, to try and make it a little more difficult and get a little bit more mobility out of there. The other thing you want to focus on is keeping your shoulders level. So if you're going up and you're kind of going, you can feel one shoulder really cheating, try to really focus on both shoulders staying level with each other so you're not cheating. Nice and slow circles. Nice and easy. We'll do one more nice slow circle here. The closer your hands are into each other, the more challenging this move is, and it will bring you more mobility. So start where you feel comfortable and then work your hands in from there. Good, perfect. You can set that off to the side for now. We're gonna work on that T-spine mobility and rotation. So I'm gonna have you take your hands behind your head, sit up nice and tall, and I want you to twist as far as you can to one side, so bringing one elbow back behind you as far as you comfortably can. And then you're gonna dip that back elbow down towards the floor, come back up, back to the center, repeat on the other side. So twist the other direction, dip down. So for me, there's a big difference between my right side and my left side. I've been nursing a 5-month-old for 5 months now, so I'm really tight on my right side. And it's okay if there's asymmetry there, that's just what we're working on, and it's good to know. And if you are a very avid golfer, you will likely have some asymmetry because you're always swinging in the same direction. So working that opposite direction, That opposite range of motion on the other side is super important to prevent some problems from cropping up from overuse and repetitive movement on just the one side. So we'll do one more each way here, dip it back, and one more this way, dip it back. Perfect. We're gonna come onto all fours, and before we get into some of the activation, I just wanna warm up the wrists a little bit because we're gonna be hands down. So take your hands, just roll out the wrist to kind of warm up. We'll do a couple stretches here just to get them ready, and because wrist fairly important in golf as well. So what you're gonna do is spread your fingertips nice and wide, place your hands on the floor, so shoulders are kind of lined up with the wrists, fingertips nice and wide, sitting back on your heels to start with, and you're just gonna circle your body over your hands, nice and gentle. And every circle, try and get a little bit deeper into that bend as you come forward. We'll go ahead and switch directions. We'll do one more circle, and then we're going to switch the position of your hands. So go ahead and turn your hands so that your fingertips are pointing away from each other. So you were here, you're just rotating out this way. Fingertips pointing away, and then you're gonna rock a little bit side to side. So it might be a little bit more intense. We're kind of brushing up for the most intense part here. Good, and then you're gonna take your hands and you're gonna point your fingers straight back at you. If this is too intense, just angle them out so that you're kind of riding the edge of your comfort zone. You don't want it to be painful, but you kind of want to ride the edge so that you can improve and move on. So fingertips pointing right back at you if you can, and then you're just going to lean back here. Take a few nice deep breaths. You can kind of rock in and out of it. Good. One more deep breath. And now you're going to take your hands and you're going to flip them. So fingertips are still pointing back at you, but as you put your hands down, your palms are going to be facing up towards the ceiling. And then again, you're just going to lean back. If this is really restricted or tight for you, or you've never stretched this way before, you might find your elbows don't straighten and you have to stay here. That's totally fine. This is just something to work towards when you are able. If you are very bent, it's also an indication that you probably need this stretch, and you should probably do it more often. Nice deep breaths here. We'll do one more deep breath. And then we'll come up, shake them out. We're gonna bring back some activation by just reaching up towards the ceiling, squeezing those fingertips real quick, quick tight squeezes. Get some blood flow back into that area. And now we're gonna come back onto our hands and knees, and we're gonna work on some activation and mobility for that anterior and posterior pelvic slings, oblique slings. So you're gonna start hands and knees. We'll do a little warm up with a cat-cow here. So go ahead and tuck your chin into your chest, round your upper spine, look in towards the belly button, pull the belly button in towards the spine. Take a nice deep breath. And as you exhale, you're gonna push through. So push the chest through, look forward slightly. So you've got a nice little arch in your low back here. And repeat. So pulling up, rounding the upper back, tuck the chin, pull the belly button in towards the spine. Exhale, push the pelvis and the chest through. Look up slightly so your lower back's rounded. Good, and we're gonna stay here now, and we're gonna work on some bird dogs. So you're going to pick a hand, the opposite foot is going to move with it. So we're gonna start by activating into your deep core. So think about taking a nice deep breath and pulling your hip bones together. So you don't just wanna suck in. So when you just suck in, all of your, all the air kind of comes up, and you have some negative intra-abdominal pressure here. So you don't want to think about sucking in and pulling up. You want to think about bringing your hip bones together to stabilize you and activate your core. So Take a nice deep breath. Think about pulling your hip bones together to stabilize you. You're gonna lift one arm and lift one leg and just hold for a 3 count. 3, 2, 1. Bring it back down. We're gonna go opposite side. 3, 2, 1. Bring it down and repeat. 3, 2, 1. Switch. 3, 2, 1. If you want to take it up a notch, make it a little bit more difficult, you can hover the knees. So now try and reach opposite leg, opposite arm. Much more of a challenge for your core. Really good for golfers because this is activating that fascial connection between opposite hip and opposite shoulder that you use when you swing. I'm going to go back down to my knees here. Do whatever works for you right now. Still working on my postpartum core, so this is more comfortable for me. And just reach and reach. We'll do one more each side here. Good, switch last time. Perfect. From here, we're gonna go into a little bit of a shoulder stretch. So you're gonna stay on your knees and you're just gonna walk your hands out as far as you can. Let your elbows drop down to the ground. Let your head rest on your mat. We've got a little bit of a puppy pose if you do yoga here. So just letting your chest fall open to the floor. Hips are high for this one. Take one more deep breath here. Good, and then we'll come up, walk your hands back in. We're gonna do one more kind of stretch plus activation for the T-spine to get some mobility going there. So you're going to get into a nice little plank position here quickly, and then we're going to dive into down dog. So bring your hips up towards the ceiling, heels go towards the floor. Spread your feet if you need more stability. You're gonna take one hand, reach it across, grab the opposite calf, shin, knee, wherever you can reach, and just pull through. Look under that opposite armpit. Take a nice deep breath here. Come back to the center. You can go into plank for a moment if you need to reset. And then back into down dog and other side. So reaching this hand across towards the opposite shin, calf, ankle area. Bringing that head in through towards the opposite armpit. Nice deep breath. We'll do one more time each side. You can come back into plank to reset quickly, and then back into down dog and twist. Look under that armpit, take a nice deep breath. Good, come forward. Last time, come back and twist. Nice deep breath. Good, and you can drop down to your knees. Come on up to kneeling position. So we're gonna get into the hip flexors. So hip flexors are really important in your swing because they connect your upper body to your lower body. And if your hip flexors are tight and restricted, your swing is going to be tight and restricted. A lot of people focus way too much on the shoulders when it comes to golf, but your hips are actually kind of the key component to getting a smooth, really powerful swing. So pick a leg to start with. One knee stays down on the mat, next knee steps forward. So foot on the floor. You can think about bringing your knees in together to stabilize you, if that helps you. And I want you to kind of tuck your tailbone under. So kind of think about pulling your rib cage and your pelvis in towards each other to engage the core so that you're not dumping forward. So tuck that pelvis and just kind of shift forward, and you should feel a nice stretch through that hip flexor. And we'll take a nice deep breath here. And whatever leg is down, that arm is going to reach up towards the sky and then bring it over your head. And then you're going to take this arm inside of that front knee, push to open up so your chest is kind of facing the side. And from here again, you're going to dive over that front leg. Beautiful. And then come back to the center. We're just going to switch sides. So switch legs, opposite leg comes up. If you need to think about squeezing those knees together for stability, go ahead and do that. Whatever knee is down, that arm is going up towards the ceiling, and then reach it over your head. Take a nice deep breath there. You're gonna take the opposite arm inside of that front knee, push to open up to the side, and then reach over your head from here. Take a nice deep breath there. Good, come back up through the center, and we're gonna come back down onto the floor, kind of in the same position we started in. So this time you're gonna drop both knees to one side and stay there. Kind of pull this front foot into rest on the opposite thigh. You can kind of tuck this back foot in a little bit here. So I want you to think about making yourself nice and tall, tractioning through the spine. Put one hand on each side of that front knee. I'm just gonna turn here so you guys can see a little bit better. One hand on each side of the front knee, make yourself nice and tall. Then you're gonna nice and slow drop that chest in towards the front knee, bend at the elbows until you feel just a little bit of a pull kind of in your glute hip area. Then you're gonna tuck your chin, push back up to where we started like you're making a wave, and we're gonna repeat that 2 more times. So maybe you can dive a little deeper this time, going down. Take a nice deep breath here. Then exhale, tuck the chin, push back up. And we're going 1 more time, down, down, down. And this time you're gonna stay down, and you're just gonna shift to look over one shoulder, and then shift to look over the other shoulder. So we'll do that 1 more time each direction. So just shift, look over one shoulder, shift, look over the other shoulder. Come back to the center. You're gonna push back up. Now you're gonna take both hands, walk them out and around over that front knee, making a big semicircle towards the back wall behind you. So you're getting a nice little twist in your upper and lower back, and you should be getting a little bit of a pull through here. If you're not, try and go kind of out a little bit more at an angle, and you can also use your chin to look up and over that back shoulder. And take a nice deep breath here. So I'm gonna have you guys stay right where you're at. I'm gonna move so you can see a little bit better for this next piece. So you walked your hands all the way out. Nice deep breath here. From here, you're gonna drop that back elbow down to the floor. And I want you to think about pushing up out of that shoulder joint so you're not sagging into it. Nice strong shoulder joint, push up here. You're gonna reach your other arm up to the ceiling. So big reach up. Keep that arm reaching the whole time and slowly drop it over your ear, over your head. Bring that arm down and around, sweep the fingertips down to the floor. Come back up through the center and repeat. So big reach up, big reach over the head and around. You can follow your hand with your eyes to get a little bit more mobility. Sweep the fingertips down. We'll do 1 more nice big circle. So big reach up, big reach over the head. Fingertips go down to the floor like you're sweeping a paintbrush on the floor. Coming back up through the center, so you're gonna push back up onto that hand and walk yourself back to where we started. So I kind of moved here. I'm gonna swing back around. And now we're gonna do the same thing on the other side. So again, I'm just gonna angle myself so you guys can have a little bit different of a view. So drop both knees to the other side. Pull that foot in to rest on this thigh, kind of tuck that back leg here. You're gonna place one hand on each side of that front knee. Make your chest nice and tall, and you're gonna drop over that chest, over that knee, drop the chest, bend the elbows till you feel just a little pull in the hip. Then tuck the chin, push back up, make that little wave, and then the wave is coming again, so go down, 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 maybe a little bit deeper. Tuck the chin, push up, making that wave 1 more time, and this time we're gonna stay down. So drop that chest over that front knee, and then you're just gonna shift to look over one shoulder, and then shift to look over the other shoulder. We're gonna do that 1 more time each direction. Shift and look over. Good, shift and look over. Come back to the center, go ahead and push up. Now you're gonna walk both hands out and around in a big semicircle over that front knee. So walk, 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 and twisting back as far as you comfortably can. You might notice one side feels better than the other. And again, use that chin to kind of look up and back behind you. Take a nice deep breath here. You should be able to feel a little bit of opening in the front of this hip as well. Nice deep breath. So again, you stay there. I'm just gonna move, change up the angle a little bit for you guys so you get a different view. Nice deep breath. And now you're gonna drop that back elbow down to the floor. Remember, not sagging into it. Stay strong, push up out of that shoulder joint. Reach the other arm up to the ceiling, big reach. And then you're gonna slowly let it drop over your ear, over your head, actively reaching. Sweep those fingertips on the floor, come up through the center, big reach up, and repeat. So over the head, reaching, reaching, reaching. Come down and around. Back up, we'll do one more nice big circle. So big reach up, big reach over, circle around. Perfect, and then you're just gonna push up off that back hand, walk yourself back to the front where we started, swing around here, and we're just gonna do some windshield wipers to clear that out. So dropping both knees to one side and then the other. So notice if it feels a little bit different for you than it did in the beginning, hopefully a little bit easier for you. Just side to side here and here. So we're gonna end with just a couple neck stretches to try and work kind of this upper neck into the trap area. Get nice and comfy. If crossing your legs works for you, I'm gonna grab a sip because my throat is failing me. So we're gonna warm up with some neck circles. Go ahead and tuck the chin into your chest, roll your ear to your shoulder. Be really mindful not to let your head drop into hyperextension. Bring it back mindfully, gently to protect it. And repeat that. We'll go same direction here. Nice and slow. And then switch directions, so going the other way, ear to the shoulder, coming around and down, over, up, back, and down. Perfect. So you're gonna go ahead, I like to rock a little bit side to side sometimes when we do neck work, just to bring your nervous system down. We're kind of at the end, so we'll just, if it feels comfortable, you can rock a little bit side to side. If that drives you nuts, don't worry about it. So just kind of rock. And as you rock, start to pull your ear down towards the same shoulder, so you're getting a little bit of a stretch here in the lateral neck. This is a good way to start. If your neck is really tight or you've had whiplash or concussion, you want to be so gentle because this area is so neurological, and overdoing it can actually have the opposite effect, and your neck will tighten because it thinks that your head is in trouble and it's not supported. So less is more with neck work. If this feels good for you, you don't have any issues, you can take this arm and just let it rest on top of your head. So you're not pulling, you're just letting it rest, adding a little bit of resistance. If it feels too much, take the arm off. Take a nice deep breath here. And then you can start to shift your nose down towards your armpit, towards the floor, just to get some different fibers of the neck here. And then slowly just let your nose come back up to the center. So to get more into the traps, you're gonna take this hand and tuck it kind of back behind you. So I like to kind of sit on it. You don't have to do that. You can always tuck it back. You can grab over here, but just kind of tuck it behind you, and then you're just gonna lean away from that shoulder. So it should be a pretty deep stretch. So if it's too intense, take the arm back and just lean away from it. Even out here, you'll still feel a little bit of something. But if you want to get deeper, tuck that arm back behind you and just nice and easy, lean away, nice deep breaths. You don't want any pain here. You don't want it to be super intense. Excuse me. You just want it to be nice and gentle getting into those upper traps. And again, you can kind of shift your nose down towards your armpit just to change the fibers, but kind of find that sticky spot wherever it feels the tightest and focus there. One more deep breath. Good, take your arm off of your head, untuck the arm, and we're just going to the other side. So other ear down towards the shoulder. Again, you can rock a little bit if it feels good for you. If you're not a fan of that, just leave it out. I like to kind of try and bring down the nervous system, especially when we're doing the neck, so that my body will kind of cooperate and let me go a little deeper into it. So again, if this feels fine, you don't have any issues, take this arm, bring it up on the head. You're not pulling, you're just resting. Nice deep breath here. Let that tissue open up a little. And then go ahead and shift your nose down towards the floor, towards your armpit. Nice deep breath there. And then you can bring your nose back up to the center to get more into that trap. You can bring this arm out here or wrap it around behind you in whatever way feels good, and then just lean away from that shoulder. Nice deep breaths. It's funny because this side does not feel nearly as tight for me as the other side did, so I can go a little bit deeper into it. And again, you can shift that nose down towards the armpit if that feels good for you. Or bring it straight forward, whatever feels most comfortable, wherever you feel like you need it the most. Your body will tell you. Good, we'll do one more deep breath here. And then take your arm off of your head, take this arm out, come back to the center. We'll end with a couple neck circles just so you can feel the difference. And we'll switch directions right away. Should feel a little bit more open, a little bit less restricted. And there you go, 30 minutes, all about mobility for golf. I hope you guys enjoyed it, and please check out my YouTube channel for more videos on stretch.